But first, we're taking a look at some health headlines. Joining us now is professor at Northwestern University Medical School and Morning News medical contributor, Dr. Lauren Streicher. Thanks for being with us again.
Good morning.
So we're going to do some health headlines of the day. First off, I think we did this story where they said metal was detected in tampons. Should people be worried about this? Talk about it.
Okay, this sounds terrifying,
Right.
but bottom line, this is nothing to panic about. So what's this all about? Got a lot of media last week. Basically, some scientists tested to look for the presence of metals in tampons. All kinds of tampons, every brand, organic, inorganic. And they found that there was metal in all of them. Arsenic, cadmium, lead. So this sounds terrible, right? But there's three reasons that no one needs to panic. Number one is there's no evidence that these metals get outside the tampon, much less get absorbed by the body. Number two, we're talking trace amounts, teeny, tiny amounts that are unlikely to be clinically significant at all. But number three is the big one. You're already getting your daily dose of arsenic in your kale salad, in your arugula, in any fruits or vegetables that either grow or in the water, because we have metals in our water supply, in the ground. So this idea that you're going to put this tampon on your body and it's going to do terrible things to you is not based in science. This is clickbait, this is fear-mongering, and in fact, the people that wrote this article said, hey, this is like no big deal. We just want people to know this. And let's just talk about organic for a minute. You know, everyone's like, oh, I'm going to use organic tampons because my vagina is going to like it much better. And the truth is organic had the highest rates of arsenic, just saying.
Interesting.
Wow.
So, I mean, there's all kinds of alternatives if you don't want to use tampons, but this is not a reason to switch.
Gotcha. All right, how about girls getting their periods at younger ages?
Yeah, this is a trend that we've seen for like the last 10 years. You know, we used to say that the age at which a girl would first get her period was really genetic. And while there is some component of that, there's a lot more going on, because what we're seeing is that girls are getting their periods younger and younger. So in this study that just came out, they tracked 70,000 girls using, wait for it, their Apple Watch data, which as far as I'm concerned is already biasing the data, because I mean, how many 11-year-old girls even have an Apple Watch?
Yeah.
But be that as it may, they did track these periods and when they got them and how often they got them. And what they found is that it used to be that the average age to get your first period was like 12-ish. Now it's more like 10 to 11. And if you look at girls that got it really young, 8, 9, 10, under the age of 11, that number has doubled. And
Wow.
the girls that get it older at 15, 16, it's like barely there. So first of all, why do we care? Well, the reason, other than the psychosocial issues of getting your period young, I mean, you know, it's very distressing. But aside from that, the girls that get their period young have a much higher risk of developing cardiovascular problems down the road and breast cancer. It's very, very clear that girls that get their period before the age of 12 have a 20% increased risk of breast cancer. So why is this happening beyond genetics? First of all, obesity. We know that excess weight is going to have, you know, earlier periods, and there is increased weight and obesity in young kids. But that only accounts for about 50%. The other part seems to be in the environment, these hormone disruptors that are in products that people use, phthalates in plastic, all of that. And then the one that I didn't know about was the impact of stress. Evidently, kids that are stressed, and kids are stressed, their cortisol levels go up, which also increases their hormone levels. So the takeaway for parents is try as best as you can to make sure your kids are eating healthy, avoiding the processed foods, keeping their weight down, and just eliminate stress from their life.
There we go.
That's
All
easy, right? No problem.
right.
It's just that easy.
Yeah.
Pregnancy complications and heart disease later in life.
Yeah, along the same lines, how these things early on impact later. And it turns out that there are a lot of things that occur during pregnancy that are going to impact the risk of cardiovascular disease and diabetes, starting with the number of kids you have. Either too little or too many seems to be the issue. So 1 is the biggest risk, or over 5. 2 seems to be the magic number. But aside from that, if you look at complications, things like, do you have high blood pressure? Did you have gestational diabetes? Which, okay, you know, that kind of makes sense. If you develop those things during pregnancy, you're going to be at high risk down the road. But preterm labor also increases the risk dramatically. And having a low birth weight baby, even if you deliver at the normal time. So what does this mean? Well, what it means is that when you're 30, 40, 50, 60, 70 years old and you go to your doctor and they say, do you have any risk factors for heart disease? it's important to mention, I had a preterm baby. I had
Okay.
a low birth weight baby, because they're not going to ask about that, and it matters. It
Real
matters.
quickly, walking and lower back pain.
Okay, lower back pain. What we know is that people that get low back pain, 7 out of 10 of them are going to have another bout of that back pain sometime within the year. So these scientists were looking to see what could they do to reduce it. So what they did is they took 700 people. Half of them they put on a walking program, walking 30 minutes a day, 5 times a week. The other half, just do what you want.
Yeah.
And what they found is that the walkers were less likely to have a bout of lower back pain. And if they did, it was like 7, 8 months later, as opposed to the non-walkers that it was 3 months later. And these were high-risk people that had an average
Okay.
of 30 episodes of back pain. So walking, it's easy.
All-
Lots of other benefits. Why
All
not?
good info.
All
Dr.
good.
Stryker's Inside Information Podcast, Menopause, Midlife, and more. Check it out. Thanks, Doctor. Good to
Thank
see
you.
you.
Thank you.
Time now for On Town.
Hey, Anna.
Good morning. We're at the